Corruption and maladministration within the country's healthcare system have raised major concerns, especially given the impact this has on public health in poor communities. We've seen numerous hospitals go under as monies intended for good is stolen and patients often end up dying in a facility meant to take care of people. The Treatment Action Campaign is calling for quality healthcare for all and an end in the cycle of corruption within the sector. TAC Chairperson Sibongile Tshabalala joins me now to discuss this further and tell us more about their concerns. Thank you very much, Sibongile, for your time here on eNCA. Now, firstly, let's just deal with the topic that has been quite big on social media and debates, whether you're at a braai or at work. And it has to do, of course, with the video we saw last week of the MEC of Health in Limpopo, Popira Matuba, basically telling a Zimbabwean patient that she would not be discharged until she settles her bill. This, of course, after finding out that she was here in the country illegally. What's TAC's reaction to this? What do you think in terms of what the MEC did?
Thank you. The TAC just had its 7th National Congress over this weekend, and this issue was brought up, and the National Congress of TAC has resolved to say we are against any form of human rights violation, irregardless where the person is coming from. And we had to go back and remind ourselves to say we are in this situation as Africans. Why? It is because our history, we were not divided by us as Africans, but the apartheid regime in 1800s, they decided to create these borders for Africa. So we are against what the MEC of Health has done, and we are calling for him to apologize publicly, and we are saying to the MEC, she must step down because she's not upholding the constitution of the country. Remember, the old constitution of the country in section 27, it says everyone has a right to quality healthcare services and emergency care. It doesn't say who has a right, but it says everyone. And the preamble of our constitution says, the South African constitution says, South Africa is for everyone who lives in it. It doesn't say we have migrants or what, or people from other countries. They should not be treated in a right manner, but their rights need to be violated. When I'm sick, irregardless of I have money or I don't have money, irregardless where I'm coming from, as long as I'm in South Africa and I seek help, I need to be provided. And remember, South Africa also signed on international laws to say they will support each other. But now South Africa is turning against our brothers and sisters. We are in Africa. We cannot isolate South Africa from Africa. We are in Africa. Zimbabweans, Malawians, Nigerians, we are all Africans. So we need to treat each other with respect.
Well, her argument was that she's not saying that they should not be treated here. She was saying that as soon as, you realize that a patient doesn't have the documentation legally to be in the country, then they should pay for the bill. Is that not enough for you? To what end, as the MEC was saying, and I don't know if you agree, because the TAC fights against, or rather you are advocates for quality health care. She says that the fact that she has to deal with so many illegal immigrants taking up the healthcare system, it overburdens it, and it means that there's less for everybody.
One, we need to remember that Africans who are in South Africa are here to seek resources. They are not here because they are here to do business. And they are not here because their countries are able to support them. They are here because others, they are refugees. They have political, we know what is happening, especially in Zimbabwe, where we have a lot of people who are coming to South Africa hiding from their own government. So that person, where do you expect that person without documents to get a job, to be able to pay for healthcare services? services. So they cannot talk about a burdening of our healthcare system while also there are no laws or policies that guides that to say when you are not a South African, you have to pay for that. And we've been challenging the government about that because that is not even on the National Health Act. So there is no law that forces a human being to pay for a bill. The law, the Constitution says everyone has a right to quality healthcare services. That means even if you are unable to pay, they need to provide you services, irregardless of race, where you are coming from, irregardless of your economic status. So you cannot hold a person in hospital and say, you are not going to be discharged here until you pay all the bills. Where do you expect that person to get money while that person is sick?
Well, let's talk about the actual summit that you had, or the conference that you had over the weekend. I know that one of the topics that you brought up is that the usual way of protesting is no longer working for the benefits of South Africans and healthcare workers and everybody who's supposed to benefit from the public healthcare system. So what would be the solution? Because the last time that something worked, of course, we'd all remember, was during the time the TAC was part of the fight against the government not giving people free antiretrovirals. And you were saying that it's not working anymore. So what would be the solution going forward?
The solution going forward is to find ways of engaging the government. One of the things that we agreed upon is to say we need to match a conversation or have conversation with the Department of Health. As we had this Congress, the Minister of Health was speaking in our Congress yesterday, and we agreed that we will have a relationship where we'll address all the issues that we are picking up on the ground, which we have seen in the past years. It has worked because we are able to deal with the issue at hand. But if they are not fixing the issues, that doesn't mean that we are not going to protest. But the kind of protesting, going to a march, mobilizing 14,000 people, pay for buses and march for one day, and come back, hand over the memorandum and come back, you wait for them to call you, it has ended. When we protest from now on, what we are going to do, we will just go to their offices and take over their offices, and we'll stage a seat in there until they come and give us answers. Because when we hand over memorandum, I think they have realized that we come, we hand a memorandum, they come and respond to that, what they want to respond, and that's it. There's nothing that is happening. But learning from what we did last year in Gauteng, protesting in Premier's office, sleeping in cold nights outside the Premier's office for 2 days, it made them to come to us and talk to us. And we were able to have a plan of action in that meeting, which at the end of the day, the department, TAC, and people living with HIV we managed to go to the facilities that we identified, and they went with us to see what we are talking about. And we were able to say, these are the issues that we are talking about. Find a way of dealing with these issues. So from now on, that's the type of protest we are going to do. If they are not listening to us, we'll stage a sit-in, we'll go occupy their offices and sit there until they meet with us, until they go with us on the ground to see what are our challenges on the ground.
Well, South Africa has had quite a tough 2 years, the whole world, in fact, because of COVID-19. And I know that the minister told you during the conference that government would, in October, be destroying millions of COVID-19 vaccines. What did you think about that? I mean, a lot of South Africans would say this means that we're out of the woods when it comes to COVID-19, but the money spent?
No, we advised the minister to say, instead of disposing all those vaccines, he must work with us on the ground, because we still believe, and he acknowledged that we haven't reached the targets that we were supposed to reach in terms of vaccination. But the thing is the problem that we have in the country. Remember, when you have to get the vaccine, you have to have identification. So people who don't have identification and the medical xenophobia that we are facing, some of them in the country are not vaccinated. So we are willing to work with the MEC, take him to the streets, People who are living in the streets are not vaccinated because they don't have access to quality healthcare services. Some key populations are not vaccinated because they don't go to facilities, public health facilities, because they are scared of being discriminated. Some of them, they think that in private companies, they need to pay for vaccines. So we said, as TAC, we are taking it upon ourselves. We are willing to work with the government to say, instead of wasting so much money and dispose so much vaccine while people need vaccines, we are willing to work with them, mobilize people on the ground so that those vaccines can be utilized in the right way instead of disposing them.
And I think maybe the problem is that it might expire. Maybe it's only a month that you have to mobilize those people. But thank you very much for speaking to us, Sibongile Tshabalala. She is the chairperson of the Treatment Action Campaign. Still to